In this video, we're going to be talking about how ankle stability, and particularly looking at calf raises. This is a really useful drill used a lot for either strengthening up calf, strengthening up your proprioception, and just general foot and ankle strength. There's variant different ways you can do it, but I'm going to show you the two-footed. So you're going to go, if you want, you can have something to hold onto. And what you'll want to do is have it so that your feet are roughly about hip width apart. And then you're going to press up nice and slowly up onto your tiptoes. And then gently lowering back down. Just up and down like so. Coming up onto your tiptoes and slowly back down. With this exercise, what you are looking for is to keep the feet so that the heels are in line. We don't want to have any bowing happening, so you don't want the heels dropping out to the side, either in or out. If you find that that is occurring, what you might find is helpful is having a ball between your heels and pressing up onto the toes, holding this ball in your feet. You can do it coming off of the edge of a step, and so that you've got a bit further to drop down. This is particularly useful if you struggle with your Achilles tendinitis and things, because you're building the strength in the lengthening stages, so you're creating a bit more load on the tendon. You might find having it and doing the exercise with bent knees, so exactly the same movement, but having your knees bent and keeping them bent as you're raising up and down, will target more for your upper calf muscles, so more onto the soleus, which just solely is responsible more for your foot and ankle movement, rather than the gastroc, which is what is targeted more when your legs are straight. You might find that you can do it single leg, so you're taking the leg up and down on one foot, which will be again more challenging, and the same variance on just the single leg movement from what we've already discussed. Or you might find that you're going up on one side and coming down on the other, so there's adding sort of changes in play like so. But see how you get on with this drill. Any questions, or if you're wanting any other advice in terms of variations, pop us a message or come and pop in to see us in clinic.